Hello everyone. In this presentation I will be covering the 2018 ICD-10-CM and coding guideline changes. These changes go into effect October 1st, 2017. In the following slides we'll be covering the 360 additions, 142 deletions, and 226 revisions that took place in the code set this year. First change for the new 2018 code set was found in Chapter 1. The code for enterocolitis due to C. diff has been deleted and two new codes were added to further specify this condition. For the next change, we're going to jump to Chapter 2, where again a code is deleted and replaced with codes that further specify the condition for malignant mast cell tumor. Another similar change was found in Chapter 2, where histiocytic and mast cell tumors of uncertain behavior was deleted and three codes were added for more specificity listed below. In Chapter 4, we find our first addition. There are two new codes that were added to the diabetes code set that we've been waiting for 2 years. They finally added type 2 diabetes with ketoacidosis with and without coma. The final change found in Chapter 4 is another code deletion of other amyloidosis with three new codes added to further specify this condition. The new codes for Chapter 5 were all additions this year. There were 9 new substance abuse codes that were added that now specify in remission. There was one final addition to Chapter 5, and that addition is avoidant restrictive food intake disorder. Chapter 6 also only saw additions, and there were 3 new codes added to this chapter, and those are listed below. Chapter 7 saw the second most code additions with a total of 55. The first group of additions specifies degenerative myopathy with other conditions. Those new codes are listed below, and they are specified by eye laterality. As part of the additions to this chapter, there were also some deletions. Blindness in both eyes has been deleted, and new codes were created to show more specificity. The first code set is listed below, and it is blindness of the right eye with a specific category, with blindness of the left eye with a specific category. Each code specifies a different category of blindness in each eye. Similar changes were made to other blindness and low vision codes. All of the changes are listed below. The less specified codes were deleted and replaced with more specific code that again shows the category of blindness or low vision in each eye. The next group of changes are seen in Chapter 9. Other secondary pulmonary hypertension has been deleted, and new codes were created with the addition of a fifth character to further specify the pulmonary hypertension. Those codes are listed below. Chapter 9 saw more additions to the Myocardial Infarction code set. Those new MI codes are listed below. The final code additions to Chapter 9 are listed on this slide. There were 9 new codes added for heart failure that specify acute, chronic, and even end stage. There was one final code addition for Eisenmenger syndrome as well. The next changes are found in Chapter 11. Gingival recession has been deleted, and new codes were added with the addition of a fifth and sixth character to further specify the condition as minimal, moderate, or severe. The next few slides will cover the changes that were made in the intestinal obstruction area. This first change was found in intestinal adhesions with obstruction, where the less specified code was deleted and new, more specific codes were added to show the adhesions with obstruction as partial or complete. As we continue the changes in the intestinal obstruction area, the unspecified intestinal code has been deleted and new codes were added to again show the unspecified intestinal obstruction as complete or partial. The change noted on this slide for Chapter 11 is now for other intestinal obstruction, which has been deleted, and new codes were added to show the other intestinal obstruction as partial or complete. The final change to the intestinal obstruction area is also the final change in Chapter 11. Post-procedural intestinal obstruction has been deleted, and the new codes are added to, once again, and for the last time, show the obstruction as partial or complete. We now move to Chapter 12. This chapter had the most additions this year with 72 new codes for non-pressure chronic ulcers. L97105 through L98498 are the new codes that were added, and they cover different body areas and different severity. So look closely in the tabular section for the specific codes for the specific body areas and severity. We move now to Chapter 13. There were 3 new codes added to this chapter relating to myopathy. Those new codes are listed below. There was only one code deletion in Chapter 13, and that was spinal stenosis of the lumbar region. 2 new codes have been added to replace that code, which now specify with or without neurogenic claudication. There was only one change noted in Chapter 14, and that change was the deletion of the code for unspecified lump in breast, and where new codes were added that further specified both the laterality and specific location of the lump. This slide starts the changes to Chapter 15. On this first slide, the changes affected the code for tubal pregnancy without intrauterine pregnancy, where that less specific code was deleted, and 3 new codes were added to specify which tube was affected. The same changes occurred to the code for tubal pregnancy with intrauterine pregnancy, where the less specified code was deleted, and 3 new codes were added to show which tube, again, was affected. The next change covers ovarian pregnancy without intrauterine pregnancy, where that code was deleted, and 3 new codes were added to show which ovary was affected. The same changes were seen here with the code for ovarian pregnancy with intrauterine pregnancy, which again now show which ovary was affected. The final changes to Chapter 15 was the addition of 28 new codes that cover maternal care for abnormalities of fetal heart rate or rhythm. Look carefully in the tabular to check for fetus and trimester, as well as the specific heart rhythm complication. We now move into Chapter 16, where there was one new code addition for gestational alloimmune liver disease. There was then a deletion of the persistent fetal circulation code, where 2 new codes were added to further specify if that was pulmonary hypertension or other persistent fetal circulation. Another change in Chapter 16 was seen with the deletion of other specified conditions of integumentary specific to newborn. They've now added 2 new codes to carve out an umbilical granuloma. The final change in Chapter 16 was the deletion of other specified disturbances of cerebral status of newborn. They've now been separated into 3 codes specifying neonatal encephalopathy or other disturbances. The first change seen in Chapter 17 was the deletion of abdominal testes unilateral, with the addition of 3 new codes that further specify this condition. The same changes occurred for the code for bilateral abdominal testes, which was deleted, and 3 new codes were added to further specify this condition as well. In Chapter 18, there were only 3 codes that were added, and they are listed below. The most important one, I feel, in this area is the code for acute respiratory distress, which many coders often see in documentation without a clear code for. The biggest change to Chapter 19 was actually the deletion of several codes. The first code sets that were deleted were those S061X7D through S069X8S. Note that only the 7th character D and S were deleted. The rest of the codes remain intact. Another big deletion was in the section for subluxation and dislocation of the thumb. Because of the rewording of many of the codes, these codes listed here were no longer needed. So pay very special attention when coding subluxation and dislocation of the thumb. The next change we see in Chapter 19 is the deletion of code T07, unspecified multiple injuries. They added 3 new codes so that this code follows suit of the rest of the injury codes with the addition of the 7th characters A, D, and S. The same changes occurred to the code T14.8, other injury of unspecified body region, where the 7 characters A, D, and S were added to again make this code look like the rest of the injury section. Another code in Chapter 19 where this change is seen is in T14.90, injury unspecified, which now has the same 7th characters A, D, and S. The final code in Chapter 19 that was updated to include A, D, and S is T14.91, suicide attempt. The only changes to Chapter 20 were the 54 new codes that were added to specify accidents involving a 3- or 4-wheel ATV and dirt bike. The code range is listed below. The first changes noted in Chapter 21 was the deletion of code Z36, encounter for antenatal screening of mother. It was deleted to allow for more specificity with the addition of 4th and 5th characters. There were 17 total new codes that were added, 7 of which are listed on this slide. The remaining 10 new codes for antenatal screening are listed on this slide, and as you'll notice, they get pretty specific on the type of screening that they are discussing, so please be extra careful when coding for antenatal screening to be sure the correct code is selected. The final additions to Chapter 21 are listed on this slide. They range from encounter for prophylactic removal of fallopian tube to risk for dental caries. As noted earlier in the presentation, there are 226 code revisions in this 2018 update. All of the revisions this time were very minor and did not impact the use of codes. Mostly it was changing or removing punctuation or non-essential words. 70 of the revisions changed the word medial to middle in the finger fracture section. Now that we have covered the ICD-10-CM changes, we're going to move into the ICD-10 guidelines. The new guidelines are available at the website listed here on the slide. Please note that the narrative changes appear in bold text. Items that are underlined have been moved, and items that are italicized indicate revisions to the headings. The first guideline change is found in section 1A15, and it has to do with the little word with. The bold text below shows where the changes were made. The main thing to take from this is you cannot assume the relationship if another guideline says you can't. For example, sepsis, or when a guideline specifically states that the linkage must be explicitly documented. The next change is found in section 1A17, and it is regarding the code also note. The bold text below is just adding that the sequencing depends on the circumstances of the encounter. The next change is in section 1B7, and the title is multiple coding for a single condition. Oftentimes we will notice in the tabular where it will say use additional code or code first. Just know that you only have to use the additional code or code first if that code is known. The change found at section 1C2E2 is regarding patients that are admitted for chemotherapy, immunotherapy, and radiation therapy. Note they added external beam in this section as well. The important note here, though, is at the bottom of the slide, when the patient is admitted for brachytherapy, that the code for malignancy should be sequenced first, and the Z51.0 code should not be assigned. Guideline is found right after the guideline that was mentioned on the previous slide in section 1C2E3, and this is for the same admission for the chemotherapy, immunotherapy, but this time the patient has developed a complication. Again, you'll see the external beam added here, but the important part is the last paragraph that notes when the patient is admitted for brachytherapy and develops a complication, the malignancy would be listed first, followed by the complications listed second. The next guideline change is found in section 1C4A3, and this has to do with diabetes with the use of insulin and oral hypoglycemics. This is a definite change this year. Basically what it's saying, if the patient is noted to be on both insulin and oral hypoglycemic drugs, we are only to capture the code for the insulin use. This same guideline is also found under 1C4A6A secondary diabetes, and it's the same rule if a patient with secondary diabetes is noted to be using both insulin and oral hypoglycemic drugs. We only pick up the code for insulin use. The next change is in the mental health section in 1C5B1, and it discusses in remission. It's giving instructions to note that mild substance use disorders should be coded to abuse in remission, whereas moderate or severe use disorders would be coded under the substance dependence in remission. The next change found in section 1C7B is regarding blindness, and it appears that this guideline was added due to the new codes that were added in the blindness and low vision section. It's basically describing how and when to use these codes when part is unspecified and part is not. So look carefully at this guideline when you're coding blindness or low vision. There is a new guideline found in section 1C9E2 regarding the new code that was added this year, acute myocardial infarction unspecified. This is now the new default code for unspecified acute MI or of unspecified type. The next coding guideline change is also regarding myocardial infarctions, but this time it's for subsequent acute myocardial infarctions. This change is found in section 1C9E4, and it discusses when to assign codes for subsequent MI, which codes for which MIs. So please make sure to follow this guideline carefully when coding subsequent acute MIs. So this is the last guideline involving myocardial infarctions, and this is found in section 1C9E5. And this guideline was created for the new codes for other types of myocardial infarctions. So as you see, everything on here is bolded, so everything is new here. So again, please pay close attention when coding other types of myocardial infarctions and read this guideline carefully. The next two slides cover the coding guideline changes for non-pressure chronic ulcers. They're found in section 1C12B1, 2, and 3. And they discuss when to and when to not code for these conditions and when to query the provider. So when coding these, please pay close attention to the new coding guidelines. The continuation for the guideline changes for the non-pressure chronic ulcers. This slide simply states that if the patient is admitted for a non-pressure ulcer at one severity and it progresses during the stay, that two codes would be used, one for the admission level and one for the highest level reported during the stay. The next guideline change is found in section 1C15Q2, and it's regarding the retained products of conception following an abortion. Note that the bolded text here is without complication, and that would be coded with O03.4 or O07.4. Also, the bolded text at the bottom is stating that if there is a specific complication, then those codes should not be used, and instead the appropriate complication in category O03 or O07 should be used instead. Effective October 1st, 2017, the coding guideline for functional quadriplegia has been deleted. The last coding guideline change is actually found in section 2K, admissions or encounters for rehabilitation. So there's quite a bit of bolded text here. Basically what it is saying is that the aftercare code should be the first listed or principal diagnosis unless the rehab is for an injury, and then the appropriate injury with the D or S, seventh character, would be used. If the rehabilitation is for an active injury, then the A, seventh character, should be used. The next bold area is talking about a patient who received rehab for a hip replacement after a right intertrochanteric femur fracture. So you would actually use the femur fracture code subsequent with routine healing as the first listed code.